As we approach Mother's Day, you might be looking for ways to help your mom take off some of the burden she no doubt is shouldering. But for many moms, it is a different story for the rest of the year, and that can have a real impact on their health. Joining me today to talk more about how we can support our moms is Dr. Charletta Dennis, Medical Director at Priority Health and a mom herself. Thank you for being here today.
Thanks for having me.
So before we dive into what's going on with mental health at different stages of motherhood and how we can support our moms, I'd love to hear more about your story, because from what I hear, you have overcome so many challenges and now you're in a position guiding and inspiring others. So if you could briefly just describe your story.
Absolutely. Well, born and raised in Detroit, I myself was a teen mom, had my first child at the age of 15, second one at the age of 19, but that didn't stop me from pursuing my dreams. I wanted to become a physician, and here I am, director of medical director at Priority Health.
So all of that, I mean, motherhood, especially at a young age, and then even becoming a physician, these are all difficult things mentally on anybody. So you're definitely an expert on the topic. Can you start by talking, I guess, about postpartum depression? This is what we hear about frequently. You hear the baby blues, and we're thinking of that immediate period after birth. For those who don't know, can you describe what's happening there? It's not just a choice to be sad.
No, it's not a choice. Postpartum depression, it actually affects about 10 to 15% of moms who have babies. And this can bring about feelings of loneliness, sadness. They can have thoughts of suicide. They also can have thoughts of harming their young one as well. And this is not a choice. This is actually an illness that requires treatment. It requires a medical professional to diagnose and to treat.
A recent study found Black moms are twice as likely to be hospitalized with mental illness immediately after giving birth. This is on top of the maternal mortality disparities we're already aware of. So physically and mentally, there's a huge discrepancy there. What is your reaction to just those numbers? There's a huge difference.
Well, when you look at the difference in the disparities, the numbers aren't alarming because I understand what some of the social determinants of health are. Sometimes we have to look at where a person is raised, what type of social supports they have, what type of education they have had, and what's available to them. A lot of times people in communities where there's not enough resources, you can see higher numbers, disparaging numbers, but the good thing is there are resources available for all ages, all social demographic areas. There is help available.
So accessing those resources, and then also just attitudes about mental illness, acknowledging that this is a problem and knowing what to do about it. What are some of the ways that a mom can access help herself if she doesn't have that built-in support system?
Well, first off, finding out what's available to her, looking at whether or not she is insured or underinsured, just trying to tap into what's available in her immediate surroundings. We do have resources available at Priority Health. We have 24-hour behavioral health care available for all of our members, and this is confidential help. There are also apps that people can turn to look for things like what types of symptoms they're going through, how can they manage these types of symptoms, what kind of things they can do personally to make themselves think and feel and be a lot better, in a better space than they are in.
I think for a lot of women, it might be scary to try to access help when you don't know what that help is going to look like. So what does it tend to be? Is it talk therapy? Is it, what are the services offered?
So it really depends on what stage of an illness someone is in. There can be mild symptoms where you just feel lonely, you feel isolated, or you feel nervous and anxious. Those types of symptoms definitely can be treated with individual psychotherapy or even group therapy. But if the symptoms start to progress to things like thoughts of suicide, then we may want to look at a higher level of care, such as inpatient care. But what I like to tell people is that you don't have to think about inpatient treatment as being thrown into a padded room. You look at it as this is something that's needed for you to survive. And I like to tell people that mental illnesses are no different from any other medical concerns. Depression, anxiety, bipolar disorder, These are medical conditions that require treatment, just like high blood pressure and diabetes.
I think a lot of women may feel a sense of guilt also because there's an expectation that you have a baby and it's all flowers and smiles and cuddles, right? So what would you say to a woman who is feeling like that, that she's done something wrong or something's wrong within her?
I would say don't feel as though something is wrong, but understand how things can become right. Try to get those resources where things can change for you. You want to make sure that you're practicing some self-care, but it's okay to seek out help. It's okay to say, you know what, I'm not doing so great right now. Maybe I do need to reach out to someone so that I can feel a lot better and so that I can provide the care that I need to my child.
Absolutely. And how about for everybody else? If you have a new mom or a mom at any stage, because we know it doesn't just get easy right after those early weeks and months, how can we offer support to the moms in our lives?
I would say meet the mom where she is. Hey, what is it that I can help you with? How can I be a resource to you? What do you need me to do? Do you need me to watch the baby for a little bit so that you can have some private time, some alone time? Do you need to recuperate? Because childbirth itself takes the body through a whirlwind, so mom needs time to recover as well.
All right. Well, Dr. Charletta Dennis, thanks so much for being here today. An important topic, especially around Mother's Day, but all year long. Thanks for being here.